Hello friends, in this video I am going to tell you about few anatomical terms and you must be familiar of these terminology at the beginning of your class because it will help you to understand the subject, the human anatomy in a much better way. So we will start our first slide. So in this first slide, you are seeing the person is standing erect. The person is standing erect and his face is toward the anterior side and his both the arms are hanging on the side of the trunk. Both the lower limbs are lying parallel and they are closer, and the feet are lying parallel and facing, the toes are facing anteriorly. So one more important thing is that the eyes of the person should face anteriorly, or he should look in a anterior direction in the same horizontal plane. He should not look at the oblique planes or the upside or the down, but the gaze of the person should be in a horizontal plane. So this defines the normal anatomical position, and all the anatomical descriptions are expressed in relation to this particular position so that there should be no inter-observer ambiguity. So you have to take this position in a reference position or the normal anatomical position, be it patient or cadaver. You have to describe all the anatomical terminologies in this, all the anatomical structures in this normal anatomical position. There are two other position. In fact, there are several other position, but the two commonly used is one is your supine position and the one is your prone position. As in this image, you can see the person is lying on his back. So and the face is on the upside. So this position in which the person is lying on his back on a surface, this position is known as supine position or the recumbent position. Next is your prone position. In this image, you can see the person is lying on his abdomen and the face is on the inferior side or toward the surface. So this position is known as prone position. So you can see this is a supine position and this is the prone position. These are the two important position in which you will often see the position of the cadaver. You usually dissect the cadaver in this supine position, and suppose we have to dissect the cadaver on the posterior aspect or on the back side, so we just keep the cadaver on his belly or the abdomen, and that position is known as prone position. Now, there are certain anatomical plane in which we divide the normal anatomical position. So one is your median sagittal plane and the one is your paramedian plane. Next is your frontal plane and one more is that is your transverse plane. This transverse plane usually used by the radiologist, and they use this transverse plane as a transaxial plane, and which we shortened the term, and it is also known as axial plane. So this transaxial, axial or the transverse plane are the synonyms. And next we, so in this image, you can see a person is standing erect and he is looking anteriorly, and both the limbs are on the side of the trunk. Palm is facing anteriorly. Both the lower limbs are closer and the feet is anteriorly, and they are lying parallel. So if we cut the body, we pass a plane through this body that is passing longitudinally. This is the longitudinal plane which is passing from superior side to the inferior side of the whole body, and it divides the body into two equal part externally. That is, one is your right side, one is your left side. So this blue plane is known as median sagittal plane. Any plane parallel to this median sagittal plane is known as paramedian plane or the parasagittal plane. Next, we have coronal plane. So if a plane is passing longitudinally through this body from superior to inferior side so that it divides the body into anterior half and the posterior half. So this pink color plane is known as coronal plane. So the plane that is passing throughout the body longitudinally, and it is and it is dividing the body into anterior part and the posterior part. This plane will be known as coronal plane. Next we have a transverse plane or the horizontal plane. If we cut the body in such a part that in such a two part that that cut the body into upper and the lower part, this is known as horizontal plane. So this yellow plane is passing through the body horizontally and is dividing the body into superior and the inferior part. So these four plane you must keep in mind while studying. Next, there are certain terms of relationship and the comparison. So first of all, you can see the superficial. What is superficial, what is intermediate, and what is deep. Anything which is nearer to the surface is known as superficial in relation to the other one. So in this diagram, if we this is the diagram at the cut section of the upper limb. Here you can see the bone, that is humerus, and these are the muscle attached on this bone. So the outer surface or the most outer the outer part is your skin. So you can if you say the muscles of the arm are superficial to the bone, so here is the bone and these are the muscle and this is the skin. So skin is superficial to the muscle and the muscle is superficial to the bone. So these are the terms of relationship. So if we describe the skin in relation to the muscle or the bone, we can say that skin is lying superficial to the muscle and skin is also lying superficial to the bone. Next we have muscle. So we can say that muscle is lying superficial to the bone. Then we have intermediate. Between the superficial and the deep structure, there is certain structure that is the position of the structure is known as intermediate. Suppose we say that muscle is intermediate between the skin and the humerus bone. So here I have told you that this position is known as, this is the position of the skin and this is the bone. If we describe the muscle in relation to the skin and the bone, we can say that muscle is lying intermediate to the skin and the bone because it is lying between these two structures. Next we have deep. Any structure that is lying farther from the surface is described as deep. Here we can see the humerus or the bone is lying inside. So this is the deeper structure in the body. So in relation to the skin, it is deeper. In relation to the muscle, the bone is deeper. If we compare the two muscle, so the muscle A is superficial to the muscle B, while muscle B is deeper to the muscle A. So I think it is clear to you what is superficial, what is intermediate, and what is deep. Okay, so in this image, I have to describe the medial and the lateral. These are the terms of the position. Anything which is lying nearer to the median plane, that is the position of that particular structure is known as medial, and any structure that is lying away from the median plane is lateral in position. Suppose we say the fifth digit, that is your little finger, is on the medial side of the hand. So here you can see this is the hand and this is the little finger. So the little finger is on the medial side, that is lying closer to the median plane. So this little finger is lying on the medial side of the hand. Next we have lateral position. If we say the thumb is lying laterally, so this is the median plane, and because the thumb is lying away from the median plane, that is why it is said that the thumb is lying on the lateral side of the body or the lateral side of the hand. So it is clear to you, it will be clear to you that what is medial and what is lateral. These are basically defined in relation to the median plane, or anything which is lying closer to median plane will be called medial, and anything away, any structure away from the median plane will be known as lateral in position. The next is your proximal and distal. Proximal structures are described as nearer to trunk or point of origin. So any structure which is closer to the trunk is known as proximal, and if it is lying away from the trunk, it is known as distal. If we say the elbow is proximal to the wrist, so here you can see this is the wrist and this is the elbow. So because it is near to the trunk, that is why the elbow is proximal to the wrist, while the wrist is situated distal to the elbow. So away from the trunk, that is known as distal, and toward the trunk it is known as proximal. If we describe any artery or the vein, so we describe the proximal and the distal according to the origin. The initial part or the part of the beginning of the artery is known as proximal. In this diagram, you can say this is the subclavian artery. So the subclavian artery is proximal while the brachial artery is distal. So this is the artery toward the origin, it is known as proximal, and if it is away from the origin, this is known as distal. Now I'm going to tell you about the distal. So farther from the trunk or the point of the origin of is known as distal. Anything situated away from the trunk is known as distal, or anything if we talk about the artery or the muscle, so the structure that is lying away from the origin will be known as distal in position. Suppose we say the wrist is distal to the elbow, because here is the wrist and it is lying distal away from the elbow or the trunk. So this is distal to the elbow. And if we talk about the artery, so this brachial artery, this is known as brachial artery. Brachial artery is distal to the subclavian or the axillary artery. So this is about the proximal and the distal position of the structure. Next, we have the superior and the inferior, then what is anterior and what is posterior. The structure lying closer to the cranial side or the head, it is known as superior, such that the heart is superior to the stomach, because we know the heart is situated in the thorax and thorax is closer to the head. So the heart is that is lying superior in relation to the stomach. Next, we have inferior. Anything which is lying near to the tail or near to the feet is known as inferior. If we say stomach is inferior to heart, because stomach is lying on the abdomen and the heart is lying in the thorax, so the stomach will be inferior and the heart will be superior. Next, we have what is anterior and what is posterior. In anterior, anything which is lying in front is known as anterior. In this case, you can see the toes are anterior to the ankle. This is feet, and here you can see the ankle, and this is the toes. So the toes are situated anteriorly while the ankle is situated posteriorly. So next we have the posterior. Posterior is also known as dorsal. If the structures are lying toward the back of the body, this is known as posterior in position, such that the heel is posterior to toes. This is the anterior side and this is the posterior side. So the heel are posterior while the toes are lying anteriorly. All the terminologies are described in normal anatomical position. So first of all, you must be clear about the normal anatomical position. Then you have to proceed on these other terminologies. So that's all about today's video. And the reference of these video is all the stuff which I have included in this video is from the Murray's Clinical Anatomy. So thank you all.